Freddie, thank you so much. As a new school year begins in Central Texas, medical experts are pointing out what they feel are concerning trends about the health of students nationwide. The vaccination rates of U.S. kindergartners inched downward last year, while the share of students with vaccine exemptions rose to an all-time high. We'd like to explore the impact of that now with Dr. Michael Burgess, who is an OBGYN and a former Republican congressman from North Texas. Dr. Burgess, welcome to our show and thanks for talking to us today.
Thanks for having me on.
I want to point out federal data is showing that just over 92% of kindergartners here in the U.S. got that required MMR vaccine last school year. That shot, we'll note, covers measles, mumps, and rubella. What stands out to you about that number?
Well, it's lower than what it should be. In order to really prevent the spread of disease throughout the population, it needs to be above 95. And any further erosion from 92 only increases the risk of a child getting infected.
Yeah. What would you say to parents or families about the importance of vaccination when the country is seeing the most number of measles cases since at least 1991? I just want to note as well that just this year, we looked it up and Texas has confirmed a total of 190 measles cases so far.
Well, parents should be interested in protecting their children from that infectious disease, and the MMR is time-tested and the way to accomplish that. Look, in some ways you can become kind of cavalier about vaccines, and I'm afraid some people have, because these are illnesses that 2 generations of Americans have not seen. But both measles and rubella is a very serious illness. Rubella particularly serious during pregnancy and can affect an unborn child and in ways where the child just simply will not recover. So the only thing you can do is to prevent the illness. And the good news is the MMR shot, measles, mumps, rubella, does provide that protection, and it provides it for school-age children all over the country. And it would be a shame to not take advantage of the protection that is available. And that's just on an individual basis. You know, all the discussion that's come up with executive orders and whatnot, do remember that the federal government really doesn't mandate shots. Your school district may have a vaccine requirement. So all of the discussion about a week ago really doesn't change the facts on the ground. But the fact that we are starting a new school year, school districts do require immunization status prior to admission or an exemption. This is for a reason. This is important stuff. So parents should pay attention to that.
You know, you touched on it there, but President Trump just signed an executive order last week that aimed to scale back the childhood immunization schedule and also space out some shots into separate visits for kids. So how do you feel about that action?
Well, it's hard to tell. I mean, one of the key phrases from the Secretary of Health and Human Services is that they want to use gold standard science. And then they have these press conferences where they don't really share their gold standard science with us. And if there is new information that they have, then for heaven's sakes, let's get it out to people. Look, like so many Texans, I've got family members who haven't been affected by autism and autism spectrum disorder. I know how serious it is, and I know how it affects families. But there is nothing, and I'll just underscore nothing, that links the MMR shot to an increase in the risk of autism. And so as a consequence, if you're interested in protecting your child, get the MMR shot.
We'll also note that vaccine exemptions last school year reached a record of 4.2%. That's according to the latest data from the CDC as well. You previously served as a Republican congressman, and some experts are saying that the rhetoric coming from the White House and the Trump administration has contributed to some of that vaccine hesitancy. So I'm curious, you spoke about it a little bit there a moment ago, but how do you respond to that criticism of those in your party?
Well, look, as a parent, you should not be getting medical advice for your child from a politician. Go to your doctor and take their advice.
And do you feel that that rhetoric is playing a part in some of the data that we're seeing here with those slipping vaccination rates and some of the increases in vaccine exemptions?
Well, I think you hear voices on both sides of that. But again, do your own research. If your interest is to protect your child, talk to your child's doctor, and I would recommend that you take their advice.
Well, Dr. Michael Burgess, we appreciate you taking the time this afternoon to talk with us and sharing that message. So thanks again for being here.
Good deal. Thank you very much.